Hello, my name is ANDREA'S, and I'm the Mental Health Services Coordinator for Dothan City Schools. One of the things that makes my position unique is that I'm the first one here at Dothan City Schools. This position did not exist until this school year, 2021. And like me, there are now 101 additional individuals that have been hired at every school district in the state of Alabama as a mental health services coordinator. And like me, many of these people have come from private practice. They were either mental health counselors or social workers, and now are working in the education system as mandated by new state laws that were passed last March.
Due to the Parkland shooting,
Wanting to make sure that the mental health of our students at every school is a priority, and making sure that every school has the proper resources to make that happen. And so here I am, I'm a resource. So one of the things me as a resource does for you today is that we are going to be talking about tracking crisis and threat assessment. We want to make sure anybody that is involved
at Dothan City Schools
has an awareness and an understanding of the process that takes place. You know what to do in the event of someone making comments about suicidal ideation or threats of self-harm, or, oh, I've harmed myself before, or I want to kill everyone or kill my parent. We don't want to leave anybody feeling helpless to deal with this situation, or as if it's all your responsibility by yourself to deal with it. We have individuals that are familiar and are trained in our protocol. We then want you to turn over our students to. Let's get started. We've got things important to talk about. There's a reason for what we're doing, and it's not just, yes, it's to prevent suicide, but there's so many other things, common misconceptions about suicide, global perspectives, and then we want to comment on children in Alabama and what we are struggling and seeing in our students here in the state of Alabama. We want to talk about why we have threat assessment,
additional things to look for that might indicate when someone may be in crisis, whether that be a student or a staff member.
Why we use a protocol. It's really important to understand that DCS has developed this crisis and threat guidance and protocol because it's congruent with our district mission, our code of conduct, safety guidelines, and our mental health initiatives. This protocol serves as a variety of purposes, right? We want to make sure that our teachers and our staff and our administrators, again, reiterating, do not feel alone in trying to resolve a crisis situation. Our expectation as a school community is to work together to resolve conflicts, crises, and of course, emergencies. We are a team, and taking a team approach, requiring those proper procedures are utilized in the team setting with our staff and administrators to help students that may be in crisis.
These protocols can be used with staff in the event that they are in crisis as well.
Carrying a great weight. Mental pain is less dramatic than physical pain, but it is more common and more hard to bear. And this is from C.S. Lewis. So yes, mental health matters. It's important to understand that we can all prevent suicide. So suicide is preventable. It's not inevitable, it's preventable. Suicide right now is the leading cause of death for school-aged children nationally and the second leading cause of death in the state of Alabama. One of our concerns is that children and adolescents spend a substantial part of their day in school or under the supervision of school personnel, whether that's sitting at a computer, they're being supervised during virtual lessons, or they're sitting in class and, supervised by an in-class teacher. Effective suicide and violence prevention is integrated with supportive mental health services and engages the entire school community. It's embedded in a positive school climate. So that's going to be our tier 1 supports that we implement, correct? Having that climate, having that school environment that feels like a hug for the brain. Therefore, it's crucial for all our staff members, not just, administrators and teachers, secretaries, clerks, to be familiar with and watchful for risk factors and warning signs of suicidal behavior
and other symptoms that a student or a staff member may be in crisis.
The entire school staff should work to create an environment where students feel safe sharing such information. Crisis response team personnel, which is going to be our school-based crisis teams, these individuals have been trained to intervene when a student is identified at risk for suicide or threat toward others. These individuals conduct suicide risk assessment, they warn and inform parents, they provide recommendations and referrals to community services, and often provide follow-up counseling and support at school. Dothan City Schools, we are committed, and we know you are too. We can all help prevent
suicide. And remember, sometimes prevention includes recognizing when someone may be in crisis. These can also include symptoms like an auditory or visual hallucination, having difficulty discerning fake from real life, having difficulty thinking that somebody is after them, Anytime that we have those types of issues, it would not hurt, and it may be best to go ahead and pass this information on, whether it be staff member or a student, to your school counselor or other member of your school-based crisis team. Top 5 misconceptions.
Let's talk about some misconceptions. Almost everyone who attempts suicide or completes suicide has given some clue or warning. Do not ignore suicide threats. Statements like, "You'll be sorry when I'm dead," or "I can't see any way out." No matter how casually or jokingly said, these may indicate serious suicidal feelings. So when someone says they are joking, that might make you feel better. "Oh, I was just kidding. Oh, I was just Googling." That person still may be suicidal, and proper assessment is important. If a person is going to kill themselves, nothing is going to stop them. That's also false. Even the most severely depressed person has mixed feelings about death, wavering until the very last moment between wanting to live and wanting to die. Most suicidal people do not want to die. They just want the pain to stop. That's where we come in. We become that resource for them, remind them that it will not last forever. It's only for right now. Another misconception: anyone who tries to kill himself or herself must really be crazy. Most suicidal people are not psychotic or insane. They may be upset, they might be grief-stricken, depressed. What about talking about suicide may give someone the idea? I've had a lot of people even who are terrified to ask that question. And no, for someone who's already struggling with suicide, it is not going to give them additional ideas. So most suicides happen suddenly without warning. Not true either. Look at all these false statements. Warning signs, verbally or behaviorally, precede most suicides, almost all in fact. Therefore, it's important to learn and understand these warning signs associated. Many individuals only show these warning signs to the closest to them.
Let's gain a global perspective of some of the concepts that we're discussing today. 450
million people on this planet are suffering from neurological, psychological disorder. 300 million people are affected by depression daily, and 60 million are affected by bipolar affective disorder.
A study from UAB Birmingham for the United States.
At the time of suicide, at least 80% of people are in a depressive episode. 3 out of the 4 people at the time of suicide are not in treatment for depression or any mental health conditions. And 5 times more likely are men to die by suicide, even though women are more likely to attempt it. Men are more likely to be successful.
Time to talk about suicide warning signs.
Warning signs: they make comments or they feel like they're a burden, being isolated, having increased anxiety, like they're getting overwhelmed really easily, or an unbearable pain. Sometimes it's physical pain. They got lots of headaches, lots of stomach issues, and it may have an emotional connection. Let's look at this. Increased substance abuse, looking for ways to lethal means. They just went out and bought a gun. Increased anger or rage, extreme mood swings, hopelessness, sleeping too much or too little, talking or posting about wanting to die, and making plans for suicide.
Let's discuss stats and data about the children in Alabama from 2020.
From January 2020 to September 2020, you have direct data from Children's Hospital of Alabama, emergency room visits and admissions. And they report that they have had a significant increase in admissions. I want you to think about COVID and when that got started, and that was in March. And if you notice, our numbers in September were almost as significant for having self-harm thoughts. We have current child crisis data as of December 2020 from the University of Alabama at Birmingham. More acute symptoms and less behavioral problems. So these are things that are coming from kids that typically may not have a lot of behavioral problems. Children with autism and developmental delays that lack structure and support services that they are accustomed to. We're seeing an increase in poor adjustment to remote learning and new roles for children and caregivers who aren't adapting well to change and exhibit an increased stress response to challenges about the child's response. Decreased value of outpatient services when the child's not in school. Parents say school is the problem, and yet there's some inconsistencies with mental health follow-up. Increased need for behavioral health services for those with no prior history of mental or behavioral concerns as societal crises persist. And the greater
mental health, but this can also create access challenges. And it's not just our students who may be struggling. It may include our staff and our teachers and our administration as well.
So let's talk about threat assessment and the why. Great quote. There's something wrong here. Have you ever heard that? Have you ever thought that? Threat assessment has gained broad support for preventing schools violence in the workplace as well and in communities. The U.S. Secret Service, FBI, and the U.S. Department of Education have all recommended that K-12 schools implement threat assessment teams. The American National Standards Institute endorsed the use of such teams in colleges in 2010 and workplaces in 2011. Many of these things can be prevented. So it's not just suicide, but threat can also be prevented, says the University of Nebraska-Lincoln forensic psychologist Mario Scalora, who studies targeted violence. The tragedy is that we sometimes take a pessimistic view that we're powerless, that we can't stop it, that we can't help it. But I think it's quite the opposite. People usually know enough to be concerned before a plan is carried out. Studies found that attackers usually plan for days and months before committing a crime. In addition, while perpetrators don't often threaten their targets directly, other people usually know enough to be concerned before a plan is carried out. And 80%, remember that number, 80% of the school's shooting cases, for example, other students knew trouble was ahead. Only few spoke up. For example, a teacher, guidance counselor, and principal were all disturbed by a high school student's poem about suicide and homicide. 2 weeks later, after the school board dismissed it as a family problem, the student shot his English teacher and a janitor with the aim of being executed by the state, so it's for homicide. He had failed to kill himself 4 times. True attempts had failed, and he was so determined that he wanted to die. He was willing to take other people's lives so that the state would then be required to execute him. At least this is what he was thinking would happen. The poem was clearly an effort to communicate, help me, help me, help me. Those considering acts of targeted violence against themselves and or others may make similar communications in an effort to get help. The attackers may also feel that they have been bullied or persecuted by others. This was the case for Evan Ramsey, who in 1997 killed his school principal and a fellow student after feeling like school authorities had given up on him. Threat assessment activation. A student can self-report, school personnel, a parent, a student, or a peer. They initiate contact with any school board crisis team member. You have your school counselor, your school nurse, your school principal, and your school social worker. The school-based crisis team, the SBCT, will assess for the level of risk and the need for interventions. They are going to do a crisis team assessment. They're going to most likely provide some level of crisis counseling. They're going to have a family consultation because they're going to notify and inform that parent and have a conversation, because parents are one of the greatest assets in a suicide or threat assessment, because they can let you know what's been going on at home. They can let you know if they've had any concerns or things that they are curious about with their child or changes that they've noticed. They're also going to be the ones that can make a referral for individualized school-based counseling. They can make a referral for mentoring and even small group counseling that's available at the school.
For students.
When should the crisis and or threat be activated? When crisis and or threats of violence or harm are reported or observed, whether that's comments, whether that we actually have observable behaviors, and anyone can make this observation. A student, a parent, a staff member, a cafeteria worker. This goes back to teachers and administrators are not to handle these crisis situations on their own. So even though anybody can make an observation, once that observation has been made, then that needs to be reported, right, to our school counselor, our school nurse, our school principal, or our school social worker. They are to follow the school protocols, and they're going to activate the crisis team for crisis assessment response.
Or determine if there's a need to activate crisis response.
So let's take a look at this. Threat assessment in action. Is it safe? Are we unsafe? What's going on? It's a great question. Threat assessment aims to interrupt people on a pathway to commit an act of harm against themselves or others. Threat assessment involves 3 functions: identify, assess, and manage. We want to intervene because that person is troubled. There's conflict internally, conflict externally, or maybe there's people that are worried about them. One way or the other, we are going to aim to interrupt them on this pathway to commit an act of harm against themselves or others. So identify. Authorities identify threat of harm to self or others. To do that, people need to know when, how, and where to report concerns. We just covered that. If you see something, say something. If you hear something, say something. At the University of Nebraska, posters and web pages encourage students to report problems of all kinds, whether it's a depressed friend or a bad joke about guns. Because it doesn't mean anything will happen. It just means at least now the data is getting to the right individuals. We want to assess. That next step in our threat assessment is gathering and evaluating information from multiple sources. That could involve security, school counselors, supervisors of human resource managers talking to the person about the concern, and his or her peers and supervisors, as well as looking at social media sites. Authorities may also analyze the person's current situation. They ask, has this person recently broken up with a girlfriend or a boyfriend, parents gone through a divorce or lost a job? How has he or she handled adversity in the past? Is this individual resilient? Those are types of questions that are part of this assessment, right? Every threat is really a symptom of a problem that someone can't resolve. Wait, what? Every threat is really a symptom of a problem that someone can't resolve. So we want to manage. According to Cornell, who developed the Virginia Student Threat Assessment Guidelines in 2006 after the Virginia shooting, more often than not, an assessment reveals a manageable underlying issue such as bullying, anxiety, or depression that mental health professionals are well trained to handle. Identify, assess, and manage the steps that show in a controlled trial to increase the use of counseling services and parent conferences and decrease long-term suspension. So these things don't just help with preventing suicide and homicide or threats of harm to others. This helps us prevent long-term suspensions. In the rare case that the assessment reveals a true threat, such as the situation in New Bedford, Massachusetts, law enforcement and other threat assessment professionals develop a plan to interrupt the potential pathway to violence. In the short term, that could mean altering potential victims and restraining the subject. In the long term, it means to aid someone who might be on the path to despair, who may be prepared to die, to move them on a path of hope. So, I want you to see yourselves as individuals and as a team unit that we are guiding our students away from suicide, and we're guiding them away from harming others. I think it's important to recognize
there are ways to speak to someone in crisis.
What kind of characteristics or qualities that we need to have in our interactions with students that are struggling. I mean, this works for all people, but we're going to talk about students today. Avoid being judgmental. We want to replace our criticisms with compassion and open-mindedness. Maintain your composure and
Be kind and reassure that you care. Dothan City Schools is committed to student and staff safety. So remember, if you see something, say something. For more information, visit our district website. Let's take a second and go there together.
Once you have opened the page, dothan.k12.al.us, I want you to go to departments, click on Exceptional Student Services, click on Mental Health Services, and scroll. This is a brand new part of our website that I really want you to explore. And if you have resources that you would like to suggest, I would love to be able to add them. So please email me and let me know if you've got any suggestions. One of the things we want you to know is that you're not alone. And in that, we also want our students to know this and feel this, right? Here's some helpful resources. We have the National Suicide Hotline. We have the Crisis Text Line. There's even the Veterans Crisis Line for those adults that, it could be a parent, it could be another staff member. I just wanted to throw this out there for you. And then there's also additional resources listed on our actual Mental Health Matters page on the district website, on the DESS page. So take a look at that. There's a few different layers there, and those layers are going to continue to grow. And again, remember, if you do happen to have some resources you'd like to share, please share them with me. So remember, mental health matters.
If you, as a staff member and employee of Dothan City Schools, is interested in contacting our Employee Assistance Program for 3 free behavioral health visits per calendar year, or a legal consultation or financial consultation, please contact our Access to Care line at 1-866-345-3017.
And remember, we can all help to prevent suicide. Thank you.